Hello everyone, I am Dr. Rose Mathew, Pediatric and Comprehensive Ophthalmologist at Zamindar Microsurgical Eye Centre, Bengaluru. Next topic of discussion is amblyopia or lazy eye. Amblyopia, most commonly called lazy eye, is a condition where there is reduction in the best corrected visual acuity in one or both eyes without any abnormalities in the retina or optic nerve. It is caused by any one or combination of the following: strabismus or squint, uncorrected refractive error. When there is unequal refractive error, anisometropia, or very high refractive error, isometropia, leading to unilateral or bilateral amblyopia respectively. When there is visual deprivation in one or both eyes, for example, like in congenital cataract or any other lesions which obstructs the visual axis, these factors, if untreated early, reduce the natural sensory experience required for proper formation of brain-eye connections during early postnatal period. Functional aspects of amblyopia. Amblyopic children can manifest abnormalities in visual processing, perception of shapes, reading speeds reduce, the 3D or depth perception is affected. Management of amblyopia. With timely detection and intervention, amblyopia is preventable or reversible. After assessing the severity of amblyopia, management involves the following steps: eliminate an obstruction of the visual axis such as cataract, etc. Correct any refractive error or squint. Promote the use of amblyopic eye by patching of the better eye by temporarily blurring the vision in the better eye with the help of atropine drops, excessive plus lens, or translucent filters or glasses. Binocular amblyopic device which engages the child in active or passive tasks using vision therapy software that require the amblyopic eye to perform majority of the visual tasks. Challenges faced during amblyopia therapy. Due to the prolonged period of treatment, there is lack of adherence to treatment, delay in detection. Amblyopia therapy is most effective up to 9 to 12 years of age, but good results are seen in older age groups also. In case of vision deprivation amblyopia, treatment has to be started very early. For example, in case of congenital cataract, when it is unilateral, surgical intervention has to take place by 6 weeks of birth, or when it is bilateral, by 10 weeks of birth. Difficulty in seeing with the weaker eye once the better eye is patched makes the child non-compliant. So these are the challenges faced during amblyopia therapy. Now, how do we counter this? Families have to be counseled and motivated about the importance of therapy and the need of consistency in carrying it out. Also, the importance of early eye checkup in children, which helps in early detection, should be emphasized. Regular school eye screenings to be conducted. With this clear understanding, let's work towards detecting and managing lazy eye or amblyopia before it leads to irreversible vision impairment.